Okay, so our project is good. The type of project we're doing is the analytical research, which is a specific type of research that involves critical thinking skills and the evaluation of facts and information relative to the research being conducted. In our project, we are using critical thinking skills to research why COVID has gotten worse and how a common cold is no longer a cold. It is most likely COVID. So the symptoms of a cold are sneezing, stuffy nose, runny nose, sore throat, coughing, mucus dripping down your throat, watery eyes, and a fever. The symptoms of COVID would be fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss or taste of smell, sore throat, congestion, or runny nose, nausea or vomiting, diarrhea, which the symptoms of a cold and COVID are very similar, which is why whenever anyone has the symptoms, you have to get tested for COVID because they don't know if you have a cold or allergies. Okay.
What is a common cold? This happens in any or all parts of the respiratory tract caused by a virus acquired from another person. It's an acute illness that happens annually and are common in smokers and usually in children. Incubation period is typically from 12 to 72 hours. The virus may still be present in nasal secretions for a week or longer after onset of symptoms. What is COVID? It is an atypical respiratory disease caused by an envelope positive sense single-stranded RNA virus. This is the current pandemic that we're in that originated in Wuhan, China. In most people, symptoms can develop from 2 to 7 days. Incubation periods range from 0 to 14 days after being exposed. Anyone can contract the virus. Studies show elderly are more susceptible.
You can go ahead, Ty.
So for diagnosis, even being vaccinated, you are still able to get COVID. There are people who do not have symptoms and still have COVID. To get medication for your cold or allergies, you have to take a rapid test to make sure your symptoms are not COVID or not from COVID to get medication to treat your cold or allergies.
You can do this one as
well. Precautions that could be taken to prevent from getting sick is getting vaccinated, wearing all safety precautions, being cautious when being around people, taking the pandemic precautions, and avoiding close contact with people who are sick.
Getting vaccinated for COVID-19 helps protect you from getting sick or severely sick. 2 weeks after getting your second dose, you are considered to be fully vaccinated. So if you only get one dose, you're not fully vaccinated. You are able to do things that were previously stopped due to COVID, like traveling or gathering in large groups, concerts. If it is effective against severe disease and death from variants of the virus, once you are vaccinated and you can contract COVID, it's a mild case with less severe symptoms.
Once you get vaccinated, it does not mean you cannot contract COVID. You are still able to be infected. Your symptoms are less likely to be severe. And although you may not have severe symptoms, you can still spread COVID. You can prevent spreading COVID-19 by following precautions of a cold, as well as wearing a mask when in public and in a crowded place. This goes along with people who are asymptomatic. Like they might have COVID and not even know about it.
The way we can prevent contracting colds, although there's no immunizations like COVID has a vaccine, you can protect yourself from getting the common cold by following the precautions, like washing your hands with soap and water for 20 seconds. You can sing the happy birthday song twice. Avoid touching any parts of your face with unwashed hands. Keep a safe distance from at least like 6 feet away from people. You can prevent spreading colds by staying at home if you're feeling sick. Avoid having close contact with others while sick. If you need to cough or sneeze, sneeze into a tissue and dispose of it. Move away from people prior to sneezing and coughing. Wash your hands after you sneeze or cough, or you blow your nose, and frequently disinfect any surfaces you might have touched.
You go ahead, Ty.
Statistics of flu cases and COVID cases. Between October 1st of 2019 and April 1st of 2020, the flu resulted in 39 to 56 million illnesses, 410,000 to 740,000 hospitalizations, 24,000 to 62,000 deaths, and 195 pediatric deaths. COVID cases totaled 251,998,404, and deaths totaled out to 5,086,101.
Why are COVID cases higher than last year? Last year, everything shut down many times because of the cases. Once the cases started to go down, everything started to open back up. We started to make it mandatory to be vaccinated to work in certain places. Once everything opened up and they did not make it mandatory to wear masks, the cases started to rise again. They made it mandatory once again to wear a mask everywhere you went, and our cases are still high and keep going up higher each day. There is not a medicine that you can take if you have COVID that has been developed. There is the monoclonal antibodies to treat COVID, but there is qualifications that you have to meet to receive this treatment. You have to be over the age of 65 unless you have an underlying health condition. Your oxygen level also has to be above 94% to receive the treatment. This treatment has helped many people recover from COVID. Okay.
In conclusion, now that we have established the aspects of how common cold is no longer considered just a cold, it is rather considered as some other infection. As nurses, it is great to recognize the signs and symptoms of an infection and to determine whether or not it needs more required attention. Diagnosing if you have a cold or allergies has become more difficult because places are turning people away to try to reduce the number of COVID cases.
That concludes our presentation. So.